So Muthu Lakshmi, today you can try at least 5 or 6 speaking sessions if possible, okay?
Okay, sir.
As many as possible. If you are tired, stop it. Don't think Simon sir is forcing me to take so many. Your wish. Mine is only suggestion. Yeah. Yes, you can start once you are ready. I'm making the notes for feedback. So Muthu Lakshmi. Muthu Lakshmi. Yeah. Yes, you can start, Muthu Lakshmi.
Yes. Good afternoon.
Good afternoon, nurse.
I am Lakshmi, one of the registered nurses working in this hospital ward. How can I help you today?
Nurse, I am little worried about my daughter, you know. I am very much upset. I feel very sad for that. I don't know how you are going to help me. Please, nurse, do something. Please, something. I'm a bit anxious. Okay. Okay. So, yeah. What should I do for my daughter, nurse?
Yes. I can understand your concerns towards your daughter's epileptic attacks, but before proceeding further, could you please tell me your name and your daughter's name and age for the better communication?
Yeah, of course. My name is Martina Hingis, Mrs. Martina Hingis, and my daughter's name is Elizabeth. She is 12 years old.
Okay, Mrs. Hingis, is that okay if I call you your second name?
Yeah, of course. You can call me Mrs. Hingis, no doubt regarding that.
Yes, thank you for providing this information, Mrs. Hingis. Elizabeth is being affected with epileptic attacks, as you mentioned earlier in our conversation.
What is that, nurse? What is that you're telling? What is epilepsy? And why should my daughter suffer with epilepsy? What is the reason? Can you explain me what is epilepsy? I want to know everything about it, nurse. My poor child is suffering.
Yes, Mrs. Hinges, it is absolutely normal to have these feelings, and being a mother, it is difficult to gone through with these events. But as we will explain, as the epileptic condition, it is one of the condition which is related to the brain activity. The impulses are getting disrupted, so that some following symptoms can be occur. Shall I explain further, Mrs. Hingis?
Yeah, of course, nurse.
Yes. So the epileptic condition has such particular symptoms: the muscle jerking and the incontinence after the seizure attacks, the incontinence and jerking of muscles and eyeballs protrusion. Those are all the symptoms which occur during the epileptic attack. Are you able to understand, Mrs. Hingis?
Yeah, of course. I'm concerned that my daughter may have other convulsive seizures. So I need to know what I should do and what I should not do in such situations. Can you please tell me some do's and don'ts, or what procedure I should follow in such things, in such conditions, nurse?
Yes, definitely, Mrs. Hingis. Firstly, I would like to share you some details regarding epilepsy attacks and also how to prevent the risk and complications after the epileptic attacks or convulsions. Is that okay for you, Mrs. Hingis?
Yeah, of course, nurse.
Yes. Before that, I would like to ask you some details regarding her her epileptic previous attacks of epilepsy. Have you ever heard this kind of attacks in in her life, childhood life?
No, nurse, this is the first time I am experiencing. Never she had any problem.
Okay, okay, Mrs. Hingis, you need not to worry. But if you follow our instructions, if you aware about the disease condition which is epilepsy or convulsions, this can be preventable. And after the epileptic attacks, the risk and associated complications can be preventable with the proper knowledge of this disease condition. Is that okay? Is that able to understand, Miss Hingis?
Yes, of course, nurse, of course.
Yes,
And what should I do if my daughter appears disoriented or begins behaving strangely?
yes, definitely, Mrs. Hingis. Firstly, if your daughter is not responding to you, if she is looking tired, then you can assume these are all the pre-symptoms of epilepsy. Immediately, I would suggest you I would suggest you during those symptoms appearance, you can place your daughter on the comfortable position lying on one side, and if any harmful objects near to her, kindly avoid those things. And also check the breathing, if she is able to breathe or any choking reactions is present. So these are all the alarming signs for pre-epileptic attacks. Is that able to follow my points, Mrs. Hingis?
Yes, of course, nurse. I can understand everything, whatever you're telling. That's quite obvious. And when should I call an ambulance?
Yes, I appreciate your question because you're taking actively part. You're participating actively towards your daughter's health condition. When the breathing is not normal, or when she became unconscious state, or is unconscious status, you can call the ambulance immediately. And also, I would suggest you some epilepsy foundations are available. They are providing the complete comprehensive care towards the epileptic patients, so that it will be easy to cope up with this condition for your daughter's betterment. How does it sound, Mrs. Hingas?
Yes, of course. That's absolutely fine. And what other support might be available for me, nurse?
Yes, others, there is a lot of support available in our society. The social groups and the occupational therapy, behavioral therapy is available with our community, so that if you want the information, so we'll provide you the local telephone book and the internet. It has a lot of information regarding the supportive centers, so you can contact them. You can avoid the further complications because of epileptic attacks can be reduced with these supportive groups. Would you like to try that, Mrs. Kinga?
Yeah, of course. Definitely, nurse. If you suggest me that will better, then I'll definitely opt for that one.
Yes. Okay, Mrs. Hingis, hope I have clarified your all concerns. If you have any doubts, please let me know, Mrs. Hingis. I'll explain you.
Yes, nurse. Definitely, I'll do that. Thank you very much.
Thank you, Mrs. Hingis. Kindly please take care of your daughter and follow our instructions without fail. Thank you so much for your kind cooperation throughout the conversation. Thank you, Mrs. Hingis. Please take care
Thank
of
you,
your daughter
nurse.
well.
Yes. So that is the end of the session. So now, yeah. So coming to the point, yeah. Let me give you some feedback now.
Okay.
Yeah. First thing is, why are you telling this Mrs. Higgins so many times? I don't
No, I have.
really understand. I don't really understand. Mute your phone. Mute your phone. Only listening. Only listening. Don't say anything because it will be distracting our. Yeah. Now, because I'm giving feedback, everyone will be writing this feedback for themselves. Those who are watching on YouTube, they will write. So in between, I don't want anything because this is just a feedback. Just feedback. So just whatever it is there, you also cannot write all these points which I'm telling you. Afterwards, you go to YouTube just to listen. That's all. So yeah. Now I don't understand really why you are saying so many times. There is no meaning in that. There is no meaning in that. So don't repeat again and again. Mrs. Hingis, Mrs. Hingis, Mrs. Hingis. It appears, something embarrassment. Why this girl is telling so many times? Why? Is she so much close to me? Even if you are close to you, that doesn't matter because only two people are there. When two people only are there and you know one another, then you don't need to take the name of the person. Okay, it makes the other person annoyed. Number one, it's general thing. If I tell you like this, Muthu Lakshmi, what you have to do? Yeah, Muthu Lakshmi. Every time I say Muthu Lakshmi, how do you feel? Do you feel comfortable? Definitely not. You will be a little upset and worried and annoyed. Why? You're mad or what? Why are you taking my name so many times? Is there anybody else here? Like that feeling will be there. So don't do that one time and again. That's not fine. Yeah, that's not advisable. That is not advised. So what you can do is avoid that as far as possible. In the beginning, just to know that he is the correct patient or she is the correct patient, you will ask and confirm the name. That's all. Once the name is confirmed, you should go forward. There is no question of any point there. There is no question. So avoid that one in every manner. Avoid that one in every manner. That's what I tell you. Next. Then second one. You said cope up with. Cope up with. Now what is this cope up with? I don't understand. Why are you using the word cope up? Cope with. Cope means it's already up is included in that one. So there is no need of up. Just cope with is enough. There is no need of anything else here. There is no need, practically no need. Yeah. Fine. Yeah. So avoid that thing. The way how you are speaking really impresses the other person. You are speaking with some sort of affection, concern. You're not bothered about your own things. You are bothered about the patients that is there. That feeling is there. So I appreciate you for that one. And at the same time, your sentences are also fine, but you can even refine them. There is always room for improvement. There is always room for improvement. You have to remember that. Yeah. The next one is And the third one, what you have to do is some sentences which I'm telling you like this in the feedback session. You can go to the YouTube and you can note them down and you can write. See, just now I have given Chabrani, okay? Dr. Jyotsna, yeah. So I have given them some sentences, right? So like that, you can write those sentences, whichever I gave on the YouTube. For example, sorry, Jyotsna I did not put on the YouTube. Who's a wrinkle? I gave some feedback, so you can take. Now I'm giving you some other sentences for feedback. Now, the question is here. What is the question? What are the precautions? What are the do's and don'ts if my daughter has convulsive seizures? Or when should I call an ambulance? Okay. So then how you are going to answer? Right. I really appreciate your concern regarding your daughter. I really appreciate your concern regarding the health of your daughter. You are very much worried because your daughter is suffering. Being a mother, your concerns are quite reasonable. If I were in your place, I would react in the similar fashion. If I were in your place, I would react in the same way, in the similar fashion. It is quite common, you know, when some of our relatives, when any one of our relatives or near loved ones are in pain, you know, it will be very difficult to control our feelings. I sincerely appreciate your questions. But as a nurse, I'm going to tell you something different. Trust me. Based on my experience, knowledge, and practical wisdom, and the experience I had in my 10 years of service, I can assure you that, I can tell you that I have seen many situations like this, many patients who faced problems like this. But during those instances, if you follow the regulations and suggestions, then everything is perfect. But if you ignore and neglect these regulations, the condition may deteriorate and it may go out of your hands. So better prevention rather than cure. So if you take the measures which are recommended by the doctor or the suggestions given during our discussion, and you can even read some articles, some authentic articles, not anything on the YouTube or internet, some authentic articles. That means the information coming from the internet, but through any medical organizations, professional organizations, then that is to be valued. And in the same way, some books on this particular, if you read, you can go for that. So All these things you can do, you can implement for the benefit, for managing the condition of your doctor. So it's not definite that your daughter may have another convulsive seizure or not. But once she got, there are chances that she may get again. So be on the go, be alert. You know that there is some problem. Be watchful, observant, and regularly monitor your child in one way or the other. At home, inform all the members of the family to keep an eye on your daughter. And at school also, tell the teacher, the headmaster, and the class teacher, and all her classmates and friends. Let everyone know that this is her condition. So in case any problem is there, they will act accordingly. Otherwise, nobody will know and nobody will help her. So if you know, then you can help her. So that is keeping that in mind. Information should be passed on to the people who are alongside her, accompanying her, or along with her at home or at school or any other place where she goes. The people who are accompanying her must know her present condition so that in emergencies they can react as required rather than panic and not know what to do. So it is good to be keeping them well informed for your own daughter's welfare. I hope you understand the importance of my suggestions. These are not just words. These are practical things which you have to follow in case of emergencies. Don't ignore these words. They may cost heavily, maybe like deteriorating the health of the child and maybe even severe problems. So in the best interest of your daughter, taking these measures seriously and implementing them accordingly based on the situations would be extremely beneficial. How does that sound? Only one time you have to say that, not too many times. So I have given you a number of sentences. If you can catch 5 sentences from this and use, that's enough.